Welcome to the Counselling Tutor Podcast, the must-listen-to podcast for students of counselling and psychotherapy. Here are your hosts, Rory Lees-Oakes and Ken Kelly.
Hello, I'm Rory, and with me, as always, is Ken. So how are you, Ken?
Exceptionally well today, Rory, hoping that you're well too, and hoping that you listening to this are well as well. This is episode 116, and you have tuned in to the Counselling Tutor Podcast, and we have an amazing episode for you today. We're going to be kicking off by speaking about different modalities of supervision. We're then going to go into Practice Matters, where we're going to be speaking about the importance of networking as a counsellor. Give us a little bit of a taster on that one, Rory.
Well, yes. I mean, counselling is a very isolated occupation, pursuit. And as a consequence of that, it's very easy for us to get kind of into a silo where we only ever see our clients and our supervisor. And I'm going to be outlining and exploring why it's really useful to network with other therapists, the benefits, and, of course, the ethical imperative to do that.
Like it, looking forward to that in Practice Matters. And we're ending episode 116 today by kicking around the ball that is pluralistic counselling. Pluralistic Counselling 101, speaking about the main topics there. But we're starting off today speaking about a topic that comes up time and time again with our qualified practitioner friends and, of course, with students alike. And that is the understanding of the different models of supervision. So we understand that as counsellors that we need to undertake supervision, but what model should we be looking at? What is the difference between the models? Rory?
Well, yeah, so the first thing I should say is that the amount of models are mind-boggling. There are so many different models of supervision. So really, if you're coming into this as a student, looking for your first supervisor, you really want somebody who supervises you in the modality you're practicing. So, for instance, one of the models of supervision is a cognitive behavioural model. And it was developed by Lees and Beck in 1997. It's specifically for working with practitioners who practice CBT. So it may not be very, very useful for a person-centered therapist. So that the first thing I would say is make sure that your supervisor understands your modality, it has a working knowledge of your modality, and also supervises in it. What you don't want, and what I've heard happening, is that you have supervisors occasionally telling students on a person-centered course that they need to put in interventions and look at automatic negative thoughts and give goals and this type of thing, which in CBT would be fine, but in person-centered therapy is a no-no. So Ken and myself are both supervisors, and we were trained in Peter Hawkins and Robin Shohat's seven-eyed model of supervision, which is, I think, just about the most popular one. You speak to a lot of people who've done recent supervision courses, and they would probably have done the seven-eyed model because it's a very comprehensive model. It's very easy to master and understand, and it really covers all the bases, Ken.
It does indeed. And I guess when we're speaking about supervision, just the very basics of that. So if we've got any student listeners and kind of you may be asked to write about what supervision is, the benefits of supervision, before ever going into supervision, before looking for a supervisor yourself, you need to have an understanding of what that is to kind of underpin your professional practice when you go into placement. And I think that at the very basic level, we need to separate different kinds of supervision. So one kind of supervision is managerial supervision. And managerial supervision does not necessarily only apply to counsellors and psychotherapists. It applies to many professionals and indeed many people in business or in office jobs, they would have managerial supervision. We then go down to clinical supervision, which is a different flavor altogether. And this is where kind of the meat and potatoes happen with us as counselors, as psychotherapists. And this is where we're going to reflect, review our practice, and you can discuss your individual cases in depth. And you're going to be changing and modifying your practice, identifying training needs based on what happens in supervision, your supervisor reflecting that back for you. And then there is professional supervision. And professional supervision is about about, and sometimes clinical supervision and professional supervision will go hand in hand for us as a counsellor. But professional supervision, again, does not only apply to counsellors. A doctor may have professional supervision, so many professionals may have that. And there you're going to be reviewing professional standards, making sure that they are in place. You're going to be keeping up with developments within the profession, identifying CPD requirements, continuing professional developmental needs that you may need to keep up to date, and making sure that you're working within a professional code of conduct to an ethical framework, I guess, if we are counsellors and psychotherapists. And as I say, very often that professional supervision, that clinical supervision will go hand in hand with a good supervisor. And indeed, both clinical and professional supervision are looked at very, very in depth in the seven-eyed model, as is the person, the individual as themselves, because you're going in as a person. So it's not all about your practice. It's about you as a person coming into that practice as well. If you've got something going on in your life, there is an element of that you may be able to bring into supervision. But at the end of the day, your supervision is not your therapy.
Yeah, absolutely. I mean, I think that's something to consider. You know, I mean, there is a boundary, and I think that boundary is held by the supervisor. Sometimes when working in supervision, there are personal issues that impact on practice, and that is something that needs to be heard and needs to be worked with and understood. But if you go to supervision purely with a personal issue, then the supervisor should be kind of saying to you, well, I hear that, but I think that this is something for your own personal therapy. And really supervision is about client work. So it is a bit of a very delicate dance. And you're quite right, there are different models, Ken. One of the models that I particularly like is the integrated development model. And that's a really useful one because it's on 3 levels. And it was developed by Stoneberg and Delworth in 1987. There's some names to conjure with, aren't there? And I think what's really interesting about it is that it's got 3 levels. And it's one that I use really in my practice. Certainly, it breaks it down to a level 1 supervisee, someone who's kind of an entry-level student, but they may be very anxious. They may not be able to evaluate the practice. So you're working at that level, and most of that would be the formative and the restorative part of supervision, which is kind of trying to help the student manage their anxieties and their feelings of incompetence and their imposter syndrome all rolled into one. And then as you move through, and I see this in my practice a lot, the level 2 supervisee is kind of mid-level. So their kind of confidence goes up and down. And they sometimes link their own personal feelings with the success of the client. So that's something to work with. The idea that somehow your own kind of attitude can impact with the clients. And then finally, as supervisees become more secure in themselves, they become more stable and they have a different form of motivation. And it's really noticeable as someone who's supervised for a number of years, you can see that model clearly played out in over the arc of a 2-year engagement with someone who's doing maybe a counselling qualification, because they start, kind of like a rabbit in the headlights, and then as they move through the arc, they become more competent. And it's wonderful, as a supervisor. I don't know about you, Ken. It's wonderful to escort a supervisee on that journey. They start at the very beginning of their practice, and as they're moving through the end of their course, they're becoming more accomplished and more polished and ready to enter professional life.
100%. Excuse me, frog in the throat today. 100% agree with you there, Rory. And I think it's important from a service user perspective, and I'm speaking about a service, you, the counsellor, using supervision, is to have a look and make sure that you're getting what you need out of supervision. If you are a trainee counsellor and then you graduate and 2 years later you're still getting the same level of supervision, that level 1 as Rory was talking about, then you're not getting what you need. You're developing. It's like when we go into education, we start off by putting together 4-piece puzzles and learning about ABC long before, but then we go through a whole developmental process before getting onto calculus and the more complex stuff that I don't quite understand. And you need a supervisor that will keep up with you, that will continuously challenge you, and you will see continuous growth within yourself and within your client's journeys, because that's what supervision is about. Supervision is always in service of your client. It's a relationship with you there, but you're bringing your clients into supervision, and you want to be seeing changes, developments, growth in your practice from your supervision. And you have a choice. We speak often about having choices as counsellors. You have a choice. If you are just going into placement and you need to find a supervisor, then a great way to do that is to phone around and maybe go and visit 3 and see who they are and how they work, and make sure it fits, make sure that the modality suits your course. But the same is true as qualified counsellors. What we don't want to do is get stuck in a rut. We need to challenge ourselves from time to time and saying, is this best meeting my needs? And if it is, that's great. But if it isn't, maybe it's time to look around and challenge yourself and go and see what else is out there.
Absolutely. And I think it's implicit within the supervision community that supervisees may go to a supervisor and say, thank you, you've taken me as far as I need to go, but I need now to find somebody else to take me onto the next level. And I think that should be celebrated. If a supervisee said to me, we've done some great work, but now I think I need to get a different perspective, then that's great. That's not a case of why you're leaving me or, being bereft at it. That's a case of a professional gaining the information they need, gaining a base, and then saying, I think I need something else now. I think I need to develop my practice in a specific way, and I need to work with a specific supervisor. An example of that may be someone who's doing more CBT and decides that they need CBT specific supervision. I was talking to a colleague who's a CBT therapist over a cup of tea a few months ago, and it was interesting. His supervisor worked completely different to the way I did, because it's a different modality of therapy, and we're just laughing about it. I said, I wouldn't even know where to start. I'm not a CBT therapist. So that's quite interesting. And I must actually talk about equality and diversity. There is a feminist model of supervision, and it was developed by the Feminist Therapy Institute in 1999. And I think my interpretation of this, and it's something that I've carried in my practice for a long time, is trying to understand that as men and women, our experience of the world differs, and it differs greatly.
Yeah.
If you've been in practice long enough, you'll hear stories from female clients, a world really didn't think existed in the way that they see the world, and also the world interacts with them. Certainly, I think in Western society and probably the world over. And part of the feminist model is to kind of engage with that and get into that frame of reference and understand, I guess, where women are coming from a political perspective. In other words, taking into account the history of equality and the work that's still to be done. So I think that's an interesting perspective, and one that I'm very, very conscious of, being that I'm outnumbered in our house because my daughter and my wife. So I'm regularly reminded of of the inequalities of the world when it comes to women's experience of it.
100% agree with you there, Rory. And to summarize this, as a client has a choice when it comes to the therapy and the modality of therapy that they may choose to engage in, we as counsellors, we have a choice. There are different models of supervision. Finding more information on the different models of supervision is an internet search away. Just jump on the internet, put in models of supervision, you'll be presented with information, and we have choices. Like our clients have choices, we have choices, and we have a requirement, an ethical requirement from time to time to monitor our practice and check that it is right. for us. Really nice topic, and a topic that was brought up on our Counselling Tutor Facebook page. You want to be on that Counselling Tutor Facebook page if you're not already a member, because that's where these discussions take place. And you can find us by going into Facebook, typing in Counselling Tutor, 2 L's in the word counselling, because we're in the UK. Counselling Tutor in Facebook. We will let you in. Come and join in the conversations. But moving away from supervision onto something interesting, Rory, when I saw the topic, I was taken back to my corporate days where networking was rammed down my throat. You only do business if you go out and you network. And networking, there's big organizations, BNI, Business Networking International. They specialize in networking for business professionals. But networking is really important for us as counsellors, as psychotherapists, as you're going to cover today, Rory, I guess, in Practice Matters.
Indeed, we're not talking about very large mobile phones, a sharp suit, and a packed file of facts. And we're really talking about, you can't have a therapist who emerges from their practice room blinking into the light and saying, "Oh, I'm not." People I ever see as my supervisor and my clients, because you need, the therapy world is getting bigger, and it's a very rich environment of learning, opinions, philosophies and views. And my belief is, and it's something that I've lived the values of for a number of years, is to get involved in that, get involved in the rich diaspora of the therapy community, because you can meet some wonderful people, you can gain some really good ideas. And as I'll explain as we go forward, it's now really an ethical imperative that we network and we don't work in isolation.
Let's jump straight into Practice Matters with Rory after this very short message.
Take the stress out of your counselling studies and get the support of Rory and I by joining us in the Counselling Study Resource. See how Counselling Study Resource can help you. Visit counsellingtutor.com. That's counsellingtutor.com.
I'm going to talk about the importance of networking, and I can share with you that through my career, networking has been really useful for a number of reasons. So what I'm going to do is I'm going to share my five top tips on networking. So number one, it can help find you work. Networking is an excellent way of finding out about upcoming jobs. And like most professions, a lot of work is via word of mouth or personal recommendation. So growing your network of contacts widens opportunity to hear about a job or career opportunities. So I think that is number one. The more people you know, the more likely you are of someone saying, "Hey, do you know there's some work available or there's a job about?" So that is one really good reason why to network in the first place. The second is it will help develop you as a professional. Meeting new people is a wonderful way of making professional contacts and sharing differing ideas and approaches. Meeting other like-minded individuals can help you learn new skills and a better understanding of theory and help develop your CV. So through the years, I've met a lot of people who have had a different take on the theory I practice, and have been able to share with me how their approach works and just differing ideas about how to work with clients. Really, really useful. And also, when you meet people up, sometimes they ask you to join their organisation as a consultant, which is really good because you can pop that onto your curriculum vitae, your CV. It all adds up to showing an employer, or if you're a private practitioner, your clients, what a rounded professional you are. The other thing is that it's a kind of an ethical imperative. So number three is the ethical imperative. Working with others in terms of gaining continuous professional development is considered best practice and referred to in the BACP ethical framework under working to professional standards. And the framework actually says, when we consider satisfying professional standards requires consulting others with relevant expertise, seeking second opinions or making referrals, we will do so in a ways that meets our commitments and obligations for client confidentiality and data protection. And I think that's really, really interesting. There isn't a week goes by where I'm not talking to another professional, maybe to get a second opinion, or maybe to get a view, or maybe to check out my own thinking on something, it is just really, really useful. And it's amazing what happens when you kind of use different people's views to help formulate your own thinking. It really can be very, very useful. Number 4 on my list is it will help you meet new people. So counselling can be a solitary occupation. We work along with clients and usually in supervision, and it can be very easy for those who are in private practice to develop a bunker mentality. Networking is not only about professional issues, it's a great way of making new friends. So, I've known therapists who've just worked, gone home, never met anybody else. And it can be very, very difficult for someone in a situation like that to kind of get into the habit of meeting new people. And if that's all you're doing, that can have a real impact on your well-being. And I met some really, really good friends and really great people through my career in counselling. And, I'm very grateful of that. But also it just reminds me not to kind of bunker myself away. So I get out of the studio, I get out and about, meet new people. Occasionally I'm asked to give guest lectures and things like that. And I found that really, really useful and quite satisfying to self. And my 5th tip is it's easier than ever. Meeting people when I started in counselling was quite difficult because social media didn't exist. I'm making myself sound ancient here, I know. But yes, the internet had only just been invented and was getting popular when I started. And nowadays, it's so easy to find groups and to find individuals and hook up with them. And good networking sites include LinkedIn, which is a professional networking site, and people can follow you, or you could click to make contact professionally with people. I found that really useful, and I met some really interesting people and done some real good collaborative work. I made a couple of friends as well, and I'd be remiss if I didn't mention the Counselling Tutor Facebook page. There's thousands of people on there from all over the world, not just in the UK, but all over the world. And it's really useful to meet up with people. I'd always say that if you are, of course, going to meet people on social media, probably best to check them out. And if you're meeting them in person, meeting a crowded place. But generally speaking, I found social media to be really, really useful. So those are my 5 tips on the importance of networking.
Thank you as always, Rory. So important, isn't it, networking? And of course, you can get Rory's super duper handout. It is free. All you need to do is go to counsellingtutor.com. Counsellingtutor.com, when you get to the homepage, you'll see right at the top the podcasts tab. Click on the podcasts tab. The menu will take you through to where all our podcasts are, and you're looking for episode 116. That's today's episode. When you click on episode 116, you are going to see everything that we've discussed today, pre-seed there, as well as any links, and we've got some good links in today's episode, particularly around our next topic, pluralistic counselling, and of course models of supervision that you can look at. You got all those links in that page, but you can also get Rory's super duper handout free of charge. All you do is you click on the little box to get that, put in your name and your email address, and we will send that to your inbox. And moving on to pluralistic counselling.
Yes, well, it's the new kiddie on the block, and it's one that's been kind of championed by Mick Cooper here in the UK, Professor Mick Cooper. And it's a bit of a step change from how we've looked at therapy before, and it links in very strongly to something called common factors. You may have heard me talk about this on the podcast before, something called the dodo bird verdict by Sol Rosenweig. And it was in 1936, he drew on imagery from Lewis Carroll, Alice and Wonderland. And the dodo bird, very, very briefly, was a bird who organised races with animals, and then everybody had to have a prize. And his theory was that all therapies are equally as effective. It's the quality of the relationship. And this has been something that's been debated ad nauseum through the years since 1936. And it's sometimes known as common factors. And this is exactly what pluralistic therapy is. Pluralistic therapy can be defined as, by Mick Cooper himself, we characterize pluralistic therapy as a specific form of therapy practice that drew on methods from a range of different sources. So immediately we can see we're looking at an integrative approach, but it's integrative with a difference, and I'll tell you what the difference is. A few years ago, there was a massive bulk of research done by an American professor called John Norcross, and it was huge. The sampling was massive. It was thousands of clients across thousands of different practice bases. So they looked at child and adolescents, couple therapy, different psychotherapies, different approaches. And interestingly enough, they kind of said that the common factors was actually true. And with few exceptions, and there are some exceptions in Norcross's research, that the quality of the relationship and the ability to repair any fractures was important. But one of the things that came out of it was that being kind of just dictating the modality to your client maybe not useful. And pluralistic is exactly what it is. It's a negotiated therapy. So you're saying to your client, well, what is it you want? And it's based in dialogue. And that's the kind of new thing about it, because in the past, we tended to be kind of bunkered in to our modalities. I know some people work in an integrative or eclectic way, but this constant negotiation, so it draws on lots of threads of more postmodern therapies like narrative therapy, where the client's developing their view of the world through their own conversations and their own stories. But the therapist is drawing on different approaches to underpin that. I think it's really exciting. And I think that in a few years, it may be, I'm not a betting man, but I think it's going to be one that they're going to be teaching at meta level. In other words, it's going to be a meta model like person-centered. And they're already starting to teach it postgraduate. I think given a seasoning and more research, we may see it stand as a model on its own. It's really exciting. Really, really is.
It is. I like it. I mean, when I was looking at pluralistic model, it really, really appealed to me in that it is 100% client-led. It is the therapist and the client working together. So yes, as the therapist, we're going to call on the literature and our studies, but we're also going to recognize of equal, if not more value, the experience that the client brings into that relationship, what their life experience has been, what they know that works for them. So it is the client and the therapist clearly working together. It's ideas and methods from the literature and the client's life experiences coming together in the therapy room. And what pluralistic therapy does is it recognizes that different people will be helped by different processes, and this will also be at different times in their life. So if they've had something that worked at one time in their life and it's now 5 years later, doesn't mean that repeating that same process is going to fit for them now. Or if something didn't work for them before, doesn't mean it's not going to be working for them now. So it's about really, it's shared decision making within the therapy process where the client has a really, really loud voice. And I saw some very strong parallels to coaching. So coaching is not therapy. We know that. That's one of the first things. If you do a coaching course, one of the first lessons is coaching is not therapy. But coaching is very successful, and it does have an evidence base that shows that coaching is very effective for the people that engage in that and use it effectively. Coaching is about setting goals, about looking at what those goals are, and about helping the individual reach those goals. And this is reflected in pluralistic therapy as well, where you may be working with the client for them to set very clear, defined goals of what they need and what they're looking to get from their therapy, what their own outcomes are. And you're going to be checking that along the way. Keep on checking in on those goals. Are we getting closer to those goals? And I think there's a beautiful ownership there from the client's perspective, because they really do set the pace. I think it feels very person-centered to me, in that the client is leading the way most of the time, and that we as therapists, we're not making assumptions that I can see you went through this experience in your life, therefore this is what's going to help you. We're not making those assumptions. We're letting the client lead the way from clearly stated outcomes and goals that they have brought to us and kind of communicated. And the three distinctive skills that I could find that are used in pluralistic therapy are the collaborative case formulation. So that's that visual mapping of where they want to go. And then us as the therapist, this is the second skill, which is distinctive to pluralistic. We as the therapist will use meta-communication, such as our clarifying, challenging, and self-monitoring and questioning. And all this just to check that we understand that we're with the client as they're going away. Very, very similar to person-centered in that way. And then that the therapist also makes use of processes to show outcome and give feedback and monitoring tools, maybe documents, logs that are shared with the client.
Yeah, it's really interesting. There's a really good quote in Therapy Today, which is the BACP's in-house magazine that gets sent to anybody who's a member of the BACP. And it states, how can we move beyond schoolism towards a paradigm that embraces the full diversity of effective therapeutic methods and perspectives? And I think that sums it up, really. Moving away. I sometimes, when I speak to therapists occasionally, I can hear them that they think their school is the answer to it all. And I have to say, and I'll hold my hands up, when I first started, I thought it was the beginning and the end as well. I was smitten with it. And now I moved through a few years in practice, now 16 years nearly of continuous practice, I realised that I draw on lots of other kind of modes. My base is still person-centred, as I said in last week's podcast. I still consider myself person-centred, but now I've got kind of better equipment should the going get tough underfoot for the client. So I think it's an interesting one. It does beg a question, though, Ken. When I was looking at this, it begs a question, and the question is, most people learn one model of therapy to a great deep level. Does pluralistic therapy ask us to learn other models to the same depth, to be truly be able to draw on them? And I think that's an interesting question. How much do we need to draw on from other models to be effective? And I think that's a question that I don't think I've seen anybody answer. So I think that maybe, if there's anybody who wants to do any research out there, I think that's a good starting point.
Agreed. Share that research with us.
Yeah,
and I guess an element of that, and it's not so much studying another model, so you might do a person-centered course and 4 years later you graduate with that, as you say, Rory. It's probably unlikely that at the end of those 4 years you go back into study and do another 5 years and do a transactional analysis course to have a really deep understanding of the use of that therapy. But I guess what we can do is continuous professional development, which we are ethically called to do, is continuous professional development. And I think if we're doing the CPD in service of our clients and looking to things like transference, Rory, which we haven't even mentioned today, which is unusual because we usually mention it in each and every podcast, having a real understanding of the different modalities or the different processes that help clients, I think that we are then acting in service of our clients. And I guess that's why we're called to do that ongoing CPD. And as you say, Rory, you graduated and now 16 years in practice. Your practice is very different to how it was. It was maybe more person-centered pure when you left, and that was the be-all and end-all. But you've kind of soaked up the other modalities and the other ways of working as you've gone along, from your CPD, from your networking, from supervision. And I'm just noticing as I'm saying all these things, it just keys into all the topics that we're covering in episode 116 here today.
Yeah, and what a great podcast it is, Ken. We started off with differing models of supervision. We moved into the importance of networking, no filofaxes or large mobile phones, but connecting, connecting with other practitioners, and we came at the end with pluralistic therapy. So a real smorgasbord of topics today. And as always, stay grounded and stay safe.
Take care.
Take the stress out of your counselling studies and get the support of Rory and I by joining us in the Counselling Study Resource. Counselling Study Resource, or CSR for short, is the world's most comprehensive assignment guidance and study support resource for students just like you of counselling and psychotherapy. See how Counselling Study Resource can help you. Visit counsellingtutor.com. That's counsellingtutor.com.